has officially been 1 year since the first case of COVID-19 has been reported, and it's safe to say that we have all been impacted by this virus in some shape or form. Whether it's local schools or workplaces closing, having to follow mask and social distancing requirements to enter stores, or the people you know or even yourself have contracted the virus. In 1 year, COVID has completely changed the way we go about our day-to-day lives so much that it's difficult to remember a time when this wasn't our norm. But even with these negative impacts the virus has caused, there are still individuals who aren't taking the CDC's guidelines seriously or even the virus itself. I have seen this behavior most commonly among my fellow colleagues at UW River Falls, as well as my past high school classmates who all choose to continue going to parties, clubs, and bars in large groups without practicing social distancing or wearing a mask around others. And with the current surge in cases in America, it is so important to understand why we need to continue following the CDC's COVID guidelines to help slow the virus's spread and to protect not only ourselves and others from the virus. The first, and what I believe is the most obvious reason to follow the CDC's COVID-19 guidelines is in doing so will help slow the spread of the virus. Currently, as of November 20th, the virus is at an all-time high with around 150,000 new cases being reported each day across the nation, according to the New York Times' article, COVID in the U.S., the latest map and case count. And if you'll give me a moment. There we go. I have the graph that the article shows. There we go. So you can see right here, we are at the beginning of the pandemic in March. So we have a bit of a rise. Here in April, we stay a bit stagnant. Until between June and July, we have a quick rise in cases. We slowly go down, but until once we hit September, which was when schools and colleges began reopening and starting first semester, we have a quick rise to our highest point, November 20th, where we are currently at our highest number of cases nationwide. This number is projected to continue increasing, especially during the month of December when the flu is at an all-time high. As of now, the most effective way of preventing COVID-19 and flattening the COVID curve, as recommended by CDC's official COVID-19 guideline under Prevent Getting Sick, is by social distancing when out in public, meaning staying 6 feet away from others when possible, and wearing a mask, again, out in public or around people who are not your immediate family members. The coronavirus is among one of the most contagious viruses to ever affect people, meaning that you can contract this virus in a number of ways, from physical contact, inhaling respiratory droplets from someone infected, or touching contaminated surfaces, and then touching either your mouth, nose, or your eyes, as stated by the CDC's COVID guideline under How COVID Spreads. So by taking measures to slow the spread of the virus, we can ensure that businesses can continue to remain open safely, schools will be able to offer safer learning environments to students, and more available medical care for COVID patients and those with other medical conditions. One of the most common arguments I hear among my classmates who are going out in public without following guidelines is that COVID has a survival rate of 99.996 for those aged 18 to 24, so even if I contract the virus, I'll be fine. While the survival rate for this age group is quite high, coronavirus affects every person differently. So a student with picture-perfect health and no underlying medical conditions can also fall victim to a severe case or even a deadly case of coronavirus. An example of this is the case of Kansas State University student 20-year-old Cecilia Eaker. Her story was published by Lily Wu from KWCH-12 titled Kansas State Student Hospitalized with COVID-19 Shares Her Story. Cecilia described herself as a healthy, active student with no underlying conditions who, like most students, believed she would not be affected by COVID-19. She would go out in public with her friends to hang out and eat at restaurants and would only social distance or wear a mask when it was required. but sadly, at the beginning of July 2020, she tested positive for the virus and was soon hospitalized after facing complications in her respiratory system. Cecilia later learned that she had developed a secondary infection in part of her lung because of COVID-19 that had to be surgically removed in order for the rest of her lung to survive. Though Cecilia is currently on the road to recovery, I believe this is the perfect example of how many people believe they are immune to this virus, but are really just as vulnerable as anyone else. And as Cecilia beautifully summarized it in a Facebook post, we are not immune, and we are not invincible to this disease just because we are young and healthy. I never thought in a million years I would get sick. I never had any underlying conditions. I was incredibly healthy and active. But I went out, I hung out with friends, and I never wore a mask until I had to. And now I regret it all. We are all still at risk. And finally, not only are you endangering your own health and safety, but you are also endangering the lives of those you may come in contact with. What many of these individuals are failing to realize is that by not following the guidelines given to us, they are potentially endangering more people than just their family and friends, but also teachers, healthcare workers, essential workers, and other members of their community. If we want to return to a normal life where we can go out in public without the fear of contracting COVID-19, as stated by Kendra Cherry from her article on verywellmind.com, How to Practice Empathy During the COVID-19 Pandemic, we all have to have more empathy towards one another and become more aware of how our choices will impact the greater community. As I have explained, with the current surge of cases in America, my apologies, it is so important to continue following the CDC's COVID guidelines. By following these guidelines, we can help slow the spread of the virus and better protect ourselves and others from contracting the virus. Once you are finished listening, I urge you to take a moment to think about the choices you have made up till this point in the pandemic and ask yourself, are my choices keeping myself and others safe, or are they endangering myself and others? If they are endangering, figure out a way to turn your choices around and what you might have to give up in order to keep yourself and your loved ones safe. It may seem difficult, but if we all follow the CDC's COVID guidelines, we can ensure that our families, friends, community members, and ourselves can stay safe and healthy during these times of uncertainty. Thank you for listening.